Cardiac cath is to insert a tube into the heart or the area nearby to examine the pressure, function, and charge of the heart. We usually take X-ray photographs of coronary arteries to see the blood flow and blockages. Cardiac catheterization is a critical procedure used to diagnose and treat certain heart conditions. When we find out a vessel is blocked, we can open it up immediately. The procedure is quite invasive due to the fact that the tube is inserted into the body, so we must explain the necessities and risks of the procedures.
Cardiac catheterization is an invasive procedure. Then why do we need it? It can confirm the diagnosis and examine blood pressure within the heart chamber as well as how much oxygen is in the blood. It's also used to get information about how arteries are blocked and narrowed and how valves are damaged. With all information, the physician is able to decide what is the best treatment plan for the patient.
While performing a cardiac catheterization, a doctor inserts a thin plastic tube, that is catheter, into an artery or vein in the groin. From there, it can be advanced into the chambers of the heart or into the coronary arteries. Then the dye is put into the catheter to make the insides of your heart and blood vessels show up on X-rays. These X-ray pictures will show whether a plaque has narrowed or blocked any of your coronary arteries. Sometimes a catheter is put into a blood vessel in your arm and is threaded up to the coronary arteries. Then the dye is injected. For this kind of procedure, general anesthesia is unnecessary. That reduces risk of arrhythmia and low blood pressure and is a safer way. Small amount of anesthetic is injected and usually patients won't feel the catheter. However, in the case of PTCA, patients may feel some discomfort when the balloon is inflated, but this is temporary and will stop when the balloon is deflated.
Things to notice before the cardiac catheterization. Before the cardiac catheterization, your doctor may order certain tests for you, such as blood test, electrocardiogram, chest X-ray, treadmill, cardiac ultrasound, and nuclear medicine examination. The doctor will elaborate on process, things to notice to you and your family, and ask you to fill out certain consent forms. During the preparation, the nurse will shave the area near the catheter entry site and mark on your instep to observe your pulse. Also, the patient must fast from at least 4 hours before the procedure.
Although cardiac catheterization is a common procedure and seems simple, but certain risks do exist due to the fact that it is an invasive procedure. When we put a tube into a vessel, especially an artery, certain risks do exist, such as bleeding, vascular rupture, and allergy to the dye we injected. In addition, stroke, myocardial infarction, and even death can happen. However, the chances are little, and after cardiac catheterization, a patient may have to undergo angioplasty or stenting, and these procedures are considered more invasive and are accompanied by higher risks. Possible risks of cardiac catheterization includes bleeding, allergy to contrast medium or drugs, stroke, myocardial infarction, kidney failure, critical arrhythmia, vascular rupture, cardiac tamponade, and may require emergent open heart surgery or cardiac catheterization redo, or even death, etc.
The way of follow-up care depends on the catheter entry site. If the tube was inserted in the arm, the incision will be bandaged. You will be checked on any changes of skin color and pulse rate, as well as symptoms of edema. Please tell your nurse immediately if you feel any discomfort. If the sheath was inserted at the groin, the incision will be closed with gauze with applied pressure for 6 hours. You will need to lie flat for 6 to 8 hours to prevent bleeding. Nurses will routinely check your pulse from the dorsal pedal artery in case of ischemia caused by compression. If you have no bleeding symptoms after 6 to 8 hours, you may try to get off the bed. It is critical to make sure that the incision is not infected or bleeding. Your nurses will check your general condition, vital signs, distal pulsation, even have the electrocardiography done to detect complications.
After receiving a cardiac catheterization, you will be observed for a night in the hospital. If you recover well, then you can be discharged the day after the procedure. For a patient after angioplasty or stenting, you have to stay in the intensive care unit or ward for a night. If your condition turned out to be normal, then you can return home.
The procedures mentioned above, such as cardiac catheterization, balloon angioplasty, and stenting, cannot eradicate the cause of atherosclerosis. They just temporarily open up the vessel. The better way is to control your diet, to exercise, and to take your medication regularly. The follow-up procedure is critical to delay the hardening of arteries and help to restore health. The preventive measures include: number 1, low fat, low salt, low sugar, and high fiber diet. Number 2, appropriate exercises. Number 3, to quit smoking, alcohol, or betel nut chewing. Number 4, to take the medications regularly. Number 5, to see your doctor for regular follow-up visits.